Had my follow-up doctor appointment with Dr. Bob this morning.
Oh, Dr. Bob.
I know. Such a good dude. God, the dude is he's inspiring in a lot of ways, still grinding through with the business and doing his thing, competing still, tactical games.
Man that walks the walk.
Oh, yeah. It turns out there's a lot of crossover, like in terms of with sort of the people, it's obviously a small world, fitness world, shooting world, tactical games has brought that together. Was talking to him about some folks that we sort of know very well, but didn't know we knew that, one another kind of thing, which was interesting. But blood work got done, checked all that out, as per usual. Been on kind of like a 3-month rolling check-in. And now I'm going to be moving more to a 6-month. I just wanted to I had been on a 6-month and I just restarted things, just kind of, so I'm nearing that 50-year mark. I just wanted to make sure. Anyway, things came back really good. And I was talking to him about peptides.
Okay.
Peptides here in California have been basically outlawed. You cannot prescribe them as a doctor anymore. Basically, the labs have been shut down. Like you can't produce or compound those things here anymore. Doesn't mean you can't get them. You can get them other places, but as a doctor, he cannot prescribe those anymore. He's very frustrated by it. And I was talking to him about it, and he asked me about my back because originally when I had gone on some peptide therapy, it was to help with my back as well as recovery and other things. And anyway, so we got into this peptide discussion. He asked me about my back. I go, you know what, Bob? I haven't even thought about my back, in quite a long time. Like it gets tight. I have nervous tissue damage. That's a problem. And so it pops up for me. But from a pain perspective and having a recovery from that pain stuff, I don't think about that at all. Now, I was just out on the range for 2 full days. These are 2 long 9-hour days. And there was a lot of obviously standing, moving, shooting, carrying gear, running around, doing stuff. And I was with a lot of people. There was actually a lot of it was all law enforcement. These guys I was training with, I got invited out to sort of audit and take this class, which was awesome. It was a really great class. I learned a bunch. Some of it was review. It was really cool to see a lot of young officers working so hard to get better. And then also a lot of older officers there. When I say older, I mean seasoned and older, in their 40s that were qualifying on some of the stuff that they were there to qualify for that was new to their department. That said, I had a ton of conversations with people about back pain. And I also, I mentioned this in another, actually in the last episode that we did specific to the volume and training, kind of looking at your training differently to get the work done, about my buddy who'd had the neck issue. And it's all kind of related. But this back pain comes up because it was one conversation after another. And it's not like I've never had these conversations before. It was just so concentrated in an active group of people that depends on their back being healthy in order to perform their job. And in one or more cases, there were guys that were not doing the job they wanted to do because of their quote unquote back issues. And that was tough for me, like to kind of listen to, because I was listening to their process and things. And in some cases, these were acute injuries, that people had suffered. Acute, meaning they had fallen, they were in some type of an accident. It was a training accident or on the job accident. One of them was a vehicle thing, a rollover vehicle accident, which is, obviously pretty traumatic. So there were some traumas there, like immediate ones, but some of them were like just cumulative. They didn't really know why. But more than that really bothered me was the way they were attacking the problem. And I just kept my mouth shut and just kind of listened quite a bit. And going, back to my buddy, I was talking about who has the neck issue, the cervical spine issue, the things that people have to go through to finally maybe figure out what's going on with their back, to maybe address it. But the bottom line was all of these people were either not working out or felt like they had to pull back from their working out in order to continue to do what they wanted to do. And all of them, there was not one that doesn't qualify here, all of them were anxious about that fact, that they weren't working out because of how it was impacting them in multiple different ways. And I think it's just a common thing. So I was like, we got to talk about this, because one, I'm frustrated, so I'm a little emotional about it because it doesn't have to be that way for a lot of reasons. But two, it just dawned on me again, just how many people suffer, right? Or are caught in this negative feedback loop of back pain for whatever the mechanisms are for that. And it kind of shuts them down, or it really challenges them in life. So that's kind of my intro to today's talk. Yeah.
Man, I mean, I think we were talking about before we were on air, that the back pain being the reason for people missing work or being out of the job is costing the U.S. specifically upwards of billions of dollars a year, because people, it's so common with our lifestyles now, with our day to day, and it's so interesting what you're talking about the anxiety that people get with back pain. I feel like it's so multifaceted. We'll get more into this, but there's so many causes. There's so much that could be going on there, but there's a lot of psychological components to back pain. And I think the anxiety and the guarding and the fear that people get around back pain is super, super impactful on how they go about it, how they handle it.
It becomes a chronic cycle.
Oh yeah,
as
for
well,
sure.
Because then they have the anxiety, which when they have any kind of sensation that's going on in their body, it then becomes a psychological thing. So then the anxiety gets worse, and then the hesitation, and it just becomes like a chronic problem. Because then when they have that sensation in their body, they think that it's pain, and the pain is going to do more harm.
Mm-hmm.
And then they don't want to be in pain, and so pain becomes the limiting factor. So then they stop moving, and that's probably one of the worst things that somebody can possibly do.
Exactly. It's only going to feed in that cycle of I feel more pain, I don't want to feel pain, then it bleeds into itself. And it's a lot neurological. Your nervous system will respond. So there's, there's even things, whether it's like a pre-injury from the past, or just in general, you have a psychology around that. There's a lot of anticipatory pain that someone can have just by thinking that a movement, that specific exercise or that specific movement is the thing causing their pain. And it's just so complicated, but it's so common. I can't tell you. I just had a conversation with a client today about it. So it's all over the place.
Yeah.
Yeah. Part of, you just mentioned like costing the workplace billions of dollars and like missed work or, whatever. It also makes the pharmaceutical industry billions of dollars a year in pain management medication, which is, again,
another whole issue.
It's a whole issue. We've covered that a million times here. But yeah, I think it's interesting what you're talking about, the psychological impact, which then turns into an emotional impact. Because if you're feeling pain, I mean, imagine what that does to, your psyche in terms of how you approach every day.
Well, yeah. And then as far as like your mood and then your sleep patterns and all of that, and then the cumulative effect over time.
Look, this resonates huge with me, right? Like I've been through my own issues. I've been, public about them. People kind of hear me talking about them. And there's many, many things that go along with this, but I would say one of the main things is feeling like you had something taken away from you, right? And so that's kind of was my thing. I think if we kind of go back, we just kind of reach back a little bit. There's always somebody that's trying to do too much, and somebody who's trying to do that is not doing enough.
Yes.
Right.
Yeah.
And then there's anything in between. We talked a little bit about this just in training in general. So if we relate this to training and people are trying to stay fit, stay in shape, do a job, reach a goal, still be a productive member of their family, society, work on any of those kinds of things. Like there are a lot of things that go into this, and it's important, I think, to address this because the psychological impacts it's weird that it goes, it's either way on this end of the spectrum or way on that end of the spectrum in terms of the way they handle stuff. I mean, my experience with folks is as soon as they start feeling, not all of them, but generally speaking, like in general population, as soon as you start feeling a little discomfort, right, then all the alarm bells start going off, right? Or the opposite, they just ignore it.
Oh yeah. I mean, there's two very, very different conversations I have to have with people who experience something like back pain. There's a one side of needing to, trust that that their body is capable, that their body is strong, that their body, I really hate this term when someone says, without an acute, an injury with a mechanism of injury. There we go. A mechanism of injury. But so people say the term, I threw my back out. It's like, no, your spine didn't just, you didn't have a vertebrae just pop out, you threw your back out. But that's a very, very common term for the person who's maybe more fearful or has a history of back, let's say flare-ups. So the conversation with them a lot is learning to trust movement, trust that their body is strong, trust that, yes, they may be in pain right now, but how do we work around that psychological component? And a lot of times I have to trick them into moving. And then by the end of their session, they're, hey, look, the thing that you were very afraid to do, now you're able to do. And that's just, we didn't fix anything magically in an hour, but we changed your view of it and we changed your body's reaction to that stimulus. The other side, what you're talking about, the person who ignores pain, I have to constantly tell them, because there's, especially I'm sure with some of those, law enforcement, first responders, all that kind of
those high performers,
those high performers, they're, a lot of it's, I can deal with the pain. I can tough it out. I can manage it. And so what I have to tell them a lot, it's like, I'm sure you can manage this pain. I'm sure you're a tough guy. You can do a lot. You're a hard worker. But if you think about this more like a check engine light in your car, right? And if you have chronic reoccurring pain, you don't ignore, that person usually is a person who also doesn't ignore their check engine light in their car. They know, hey, my car, it's not broken down. I can't drive it necessarily, but there's something I need to check out. There's something I need to look into. There's something I'm doing or not doing that is causing this. So back pain's for that person, and whether it's back pain or other kinds of discomfort is, we can work around this. We can find things. You don't need to halt the brakes completely, but we shouldn't keep ignoring that check engine light. We need to look into that. What's causing that to come on?
I think you just brought up a really good point, specifically in that employment population you mentioned, and them being very acutely aware of like, oh, there's a check engine light. There's a warning light on here. I need to check this out. It goes into the next step. This is kind of where the rabbit hole can kind of start for folks like that too, that are pushing, right? And the check engine light goes on. And any other thing, they would try to diagnose that problem right now, and that would be a challenge for them. And number two, they would want to find the solution, because they're, generally speaking, I want to say, they're solution finders. They fix problems. In specifically talking about that population, not that we have to stay there, but like for the high achiever, they're generally problem solvers, right? They're solution finders. Going back to the first responders, that's what they do. They fix other people's problems. That is their job, right? Or at least attempt to. And so the irony in this whole thing is like they are trying to fix a problem somehow that they are not equipped to necessarily identify, assess, right? And or equipped to address. But at the same time, if even one little thing seems to work, that's what they hang on. Like that is
every day.
All day, every day.
I'm just going to roll it out for 45 minutes before every workout, and then every night before I go to bed, and that'll manage it, because I feel a little relief with that. So that's a perfect example.
That's a perfect example. Yeah. So the engine light went off for a minute.
Yes.
Right? Oh, it's fine. Oh, came back in. Oh, well, I know how to turn it off.
Yeah.
I just roll it out.
Just keep shoving it down. Just keep masking it over. Put that tape over it.
Basically. Yeah, exactly. All you're doing is kind of resetting, the computer.
Yes.
For a minute. But that doesn't mean you fix the problem. You're just hitting the reset button. And so there's a negative feedback loop happening in there somewhere, and that's why that back pain is popping up. So that is an issue. And you just really did a really good job, I think, of identifying the kind of the different types. And I think probably a lot of people listening to this right now can identify as one or the other, right? Now, I think both could probably also agree, like, I don't like to be in pain. Humans don't like pain.
Who does?
Right? We have check engine lights for a reason, and the pain is that mechanism, right? Like pain equals, hey, something's up, right? And the degree to which you feel that pain, or when that pain arrives for you or shows up for you, often is based on your life experience, right? And in all kinds of things. But certainly if you've done hard things in your life, maybe, and then, we could equate that to maybe playing sports, and having to really push hard and really being broken down, and sometimes even getting hurt, or further than that, getting injured, you kind of understand different degrees or different levels of like, when does that check engine light go on, right? Is this an orange light? Or is this a red light?
Yeah.
Right? Because the orange light is like, oh, you're low on gas. No problem. It's not red yet. Like I can keep working through that, right? Or, something else. Like it's some kind of hey, you need to check your tire pressure. All right, well, it's just orange. Orange is not a big deal. But something red pops up on your dashboard, in this case, we're talking about pain. That's a different story. So that's an interesting thing too, in terms of where people, I guess the dial or the gauge would be more the appropriate term, the gauge of where that pain sends up the red the red alert to where, I really have to address this now. And oftentimes it's at that point where you're being taken out of the game, whatever it is. Like, and I know what that feels like. I know you guys know what that feels like, for a lot of people listening that know what that feel like. Oh, fuck. Like, I'm done. Like, I can't stand up. I am crawling. I can't put my underpants on. I can't go to the bathroom. Like, I can't, when I go to the bathroom, I can't, do the things I need to do in the bathroom. All that kind of stuff. Like, if you've been there, you know what I'm talking about. And we can chuckle about it and laugh, but it sucks.
It sucks. Yeah.
It's debilitating.
That is the word.
Yeah.
That's the word I would use every time. Like, when you're debilitated. Yeah. Because you're a wreck. You're basically worthless.
Yeah. And I mean, especially for the person, we've talked a lot about the emotional, psychological benefits of movement and exercise. So if you're the person that, and not even talking about even more so with an athlete, when an athlete gets injured and that's their whole world, that's where they find a lot of their identity, and then that's taken away, or sometimes it's taken away, or sometimes they feel it's taken away. So that's kind of part of this conversation too. It can be debilitating. Emotionally, it's super damaging. It's hard to work around.
Well, I mean, as far as, individuals like athletes or those who are in very physically active occupations, when that's taken away, it's very much like a death process of grieving, as far as like the whole denial and experiencing anger and all of that, the various stages of grief.
Yeah.
So.
That's a super good point. Yeah.
Yeah. When I walked off the jujitsu mat, that's how I felt, man. I was fucking wrecked, like hardcore and still have a tough time with it. But I think the other side of that is, if you haven't done hard things or you don't have a really good gauge for pain, any little, tick of like, ooh, like what was that? Like, can shut somebody down in exactly the same way. It can paralyze them with that fear of it getting worse, whatever that might be. Again, having no gauge for the threshold of what worse is or isn't. So that's not to take away from, people's emotions and what they may be feeling about things. That's not what we're here to discuss. But I think it's just interesting how people get themselves into these problems. And more interesting is how they go about either trying to fix it or not fix it. So we kind of talk, and I think we should probably keep it to the person that is pushing and trying to work out or does this regularly. And something you need to accept is, if you are pushing and you are doing hard things and you are constantly challenging yourself, as well as going through all the things that life presents for you, whether that's sitting down in a car, going back to the first responders, carrying heavy equipment on your back, if you're a firefighter, carrying plate carriers around your waist, sitting in the car, helmets, all kinds of those kinds of things. Working in a hospital as a nurse, you're moving heavy things, heavy people around, those kind of things, whether you're in shape or not. Very awkward positions. You're often, if you are fit, you're likely doing more work than other unfit people that are supposed to be there helping you. I know this well. We have nurses that work out here. My mom's been one for a long time. I work with EMTs, and sometimes they're partnered up with some other pretty unhealthy medics or EMTs, where they find themselves on the lion's share of doing some of these things that put them into positions. So these are the people that are generally kind of pushing anyway, right? And so when you push and you're doing stuff like that and you do it long enough, inevitably something is going to pop up, right? You may get hurt. Like, something may happen. You may stress the body to a point where the check engine light ends up coming on. It's just what you're doing once that happens that is an interesting phenomenon.
Well, and it's interesting. You kind of mentioned it with people you had these discussions with, but that kind of person is, we tend to pull the thing that we think is causing it, but still do the things that we feel are non-negotiable. So a lot of those people, I'm sure, they're still at that event. They're still out on the range. They're still shooting. They're still going to their job. They're still in the hospital, whatever they're doing. But they think, okay, the exercising was the thing, or the movement was the thing that was causing this, or every time I do this, I feel it more acutely, or I'm more aware of it in that. So they pull this away. They stop doing that, but they can't not do these things. But eventually that's going to catch up with you. You got to go to your job every day. So if you're too, I want to say fearful, but if you're backing up so far from the work that you're doing to better it in the gym and with your exercise routine, which that may feel like it's the cause or the thing that's irritating it right now, maybe that's time to reassess what you're doing. What's your process look like? What exercises are you doing? What's the implementation? What's the load? All these other things. Not just, I'm going to take that completely out and hope it gets better. Because I can almost guarantee you, for most people, that's not going to be the fix.
Yeah, that rolls back to what you were saying before about when they find the thing that seemingly makes it better.
Yes.
They're as locked into that as they are about not doing the thing that seemingly makes it feel bad.
Yes.
Right. So going back to like, I'll just roll it out.
Yeah.
This is what you're saying before. So it's like, this drove me nuts. I just sit there and bite my lip yesterday. And there's this guy, he was going on, and I felt bad for him because he's in a position of leadership, and he was conducting himself as a leader in all the ways that I would expect a leader to be, right? And maybe in the position that he has, and I won't go any more detail than that, but I would say this. He's not taking care of himself the way a leader should be if he continues to want to be a leader. And so I want to come back to this. I think this is kind of an underlying theme for some other things to talk about. But my point of that is like, he knows I don't think he exactly knows what the issue is, but he thinks he does. So there's like an overinflated self-confidence maybe about what the issue is. He heard what he heard. I think he heard what he wanted to hear in what I was listening to from those that checked him out, right? And those that are in charge of sort of his health care, if you will. And the answer that he walked away with is, I need to stretch more. Right? That is such a broad statement.
Yeah.
And he was also there hurting. Like, and by day 2, he was hurting bad. And I could tell. He's like, I just need to stretch more. I need to get into this contraption that I have, basically, that creates some traction and whatever else.
Passive traction.
Yeah, and that's the thing. That is the thing that helps me. That's what makes me feel better. That's what's going to fix me. And I'm just looking at it going, look, man, for me, like, again, biting my lip in my head going, man, there's so many things. Just immediate relief.
That's it, right?
You're at the pinnacle of you worked your entire career to get to where you're at right now, right? And what you're doing is totally irresponsible if you want to continue down this career path and have a successful... The other thing I think about in these things is like, what has to happen for that person to finally just give all that up, and what rock bottom point that they have to hit before they're like, oh, that isn't working. And they're faced with the reality of, you really haven't been addressing this. You've just been hitting the reset button to get that light to turn off, right? For a minute. And then it comes back on.
Well, there's got to be an awareness thing for him too. I would think maybe maybe he's just not aware that there's more that he can do, or that he's limiting himself. And I don't know.
Man, pain is so weird though, because I feel like someone like that who's been dealing with it for a long time, so many people, especially today, accept that chronic pain or reoccurring pain is just part of their existence.
Yeah.
Right. It just
becomes norm.
It just becomes normal. So, okay, it's at let's say it's at a 5 out of 10 all the time. But when I do my passive traction and my stretching, it goes down to a 2 for an hour or so. So, okay, that's having an effect. It goes right back up to a 5. They're just used to, I just have a bad back. And that's just what they deal with. When really, I mean, unless there's these extreme cases of very orthopedic changes in the structure of your spine or things like that, there can always be some degree of improvement with the intentional a plan of attack on it, and something that's progressive, not something that's just masking symptoms, but something that is actually trying to fix the mechanism or improve the mechanism of pain.
Yeah, this is a great part to transition, I think, from, and that is what you just said. Specific to what you were saying, Cece, and that is getting a higher level of awareness about what the issue is. And I think that's where a lot of the challenge lies with people, is they don't actually know what the problem is. And not that they should be exercise physiologists or biomechanists or, have some type of exercise science degree or biology degree or, spend time in anatomy classes or anything like that. That's not what I'm saying. But you should understand what your specific problem is before you're trying to figure out what exercise is the right one or the wrong one, or what stretch fixes the problem or doesn't fix the problem. You need to understand what the problem is, right? And we could paint probably all kinds of analogies, for people about how kind of ridiculous that sounds for you to be trying to fix something that you don't know anything about. So one of the things that drives me bonkers in the fitness industry is like these coaches or these trainers that go, oh, look at how dysfunctional that is, right? Like, oh, look at that guy move. Look at all that dysfunction, like in the shoulder or the hip or the ankle or the knees or whatever else, or, his form. Look at how messed up that form is. I need you to be able to tell me what proper function is first, and or what form even is, man. Like, tell me what it is that you mean by that. Because when you start chipping away at that question, it's never ceases to amaze me how little they actually know about what proper function is. So before I go banging away on, if this exercise will fix that problem, that quote unquote dysfunction, when you can't even tell me what proper function should look like, right, in that particular context or application. But if I do this exercise, it'll fix it. That's really ridiculous. It's rooted in very little rationale or logic, yet we see it happening all the time. I feel pain here. I relate that pain to this problem, whatever it happens to be. We can get into a few of these things that pop up. What are the exercises or stretches that I need to do in order to fix what I perceive to be the problem based on little to no foundation or rationale for doing that? That is the self-diagnosis that happens quite frequently, and or diagnosis that somebody that's unqualified, that has no business making a diagnosis or an assessment, is making or giving somebody. And now we're kind of in a weird world now where you used to have to go to a gym or go to a therapist's office, like physical therapist or a practitioner's office, chiropractor or something like that, or a doctor or whatever to get this information. Now I just fucking pull up the pocket computer and I just start scrolling or whatever else. And I think that's a big problem because I know it's a big problem because what it does is it ends up confusing people. It gives people this false sense of confidence. Mm-hmm. And then they wind up making some pretty, I think, it leads to poor decision making.
Man, there's a post, go ahead.
I was going to say, at the same time, like to be devil's advocate, there's that, but you said it earlier, Ryan, it's so multifaceted as far as this issue because maybe they're doing their pocket computer because they've gone to their GP and their GP wants to throw, medication or anti-inflammatories or something at them and they're not giving them a diagnosis, but they have to take this medication for a period of time before they can do any other type of diagnostic tests because that's what's required by insurance companies.
Right. No, I get it.
It's just a vicious cycle. So
everything.
For somebody that is wanting to do something about the pain that they're in and they don't know where to start, but yet, they're not getting any answers from their doctor, then yeah, I can see why they would turn to the pocket computer or to social media and looking at, whatever is out there, to try to get some answers.
Here's the other part. The other part is to find the answer that they want versus the one that's the right one or that they already got.
Very
They're
true.
doing that as well. Yeah. And so they kind of already know the answer in their head. They're just looking for something else to validate what they think or that gives them, I'll paint the picture. The person that knows they have an issue, they've gone to and this issue has maybe debilitated them a time or two, but they're working out hard all the time and they're fit or they're in shape or they're seemingly achieving or have achieved whatever goal that they want to achieve. They have this problem. They go see somebody, a qualified expert. That qualified expert gives them a very specific diagnosis. Or maybe it's not as specific as they would like it to be. They would need more maybe testing, or even with testing or diagnostic testing, you can't always see or know everything, right? So they've gotten a pretty good answer, yet they don't like that answer. And that answer is you need to spend, maybe that answer is and this would be an example of maybe a good answer. Here's what we have here. This is a soft tissue problem, right? Not an orthopedic issue. You have quite a bit of weakness right here, and you have quite a bit of, let's call it tightness. You're over strong or overcompensating here. You need to do these movements, these exercises in this way over this period of time before you can then advance to maybe the next things that we won't know until you get there, until you put in the work to get through this thing. And over time, we should be able to fix that. In the meantime, we may be able to fix it based on my experience and based on what we know. In the meantime, here's some things that you may want to do less of, because it's likely exacerbating your problem, right? Or it could be. And so for at least a little bit of time, we should reduce the volume of that or the intensity of that. And that is where the person starts going, oh, I'm not doing that. Because if I do that, then I lose all my gains. They've already made up in their mind, if I take time away from my regular stuff, this goes back to a little bit about what you were saying, Ryan. If I take a little bit away from these things that I regularly do and I spend that time over here addressing shit that is not sexy, is kind of boring, and doesn't give me quote unquote gains, then I will lose the gains and I will lose the fitness that I have. That is the picture and the narrative that gets put in a lot of people's heads. So going back to what you were saying, Cece, about they got an answer or they're not getting the right answer. Sometimes it's a denial of people just like not wanting to accept the answer that they got, even though it may be a very legitimate, well put together solution or answer.
Yeah, and I mean, I do see that a lot where people just don't want to. I mean, it's the typical, our PT friends. The client gets the PT exercises, they feel good, but then they go home and they never do them, right? So that kind of thing. On the other side, to go the other way, I think a lot of the answers I see given are just simply avoiding it. On the other end, it's not. There's someone I know right now, a client, who they did the typical thing. They were dealing with back pain. They got a scan, which can be a tool for your assessment to get a closer look at what's going on. But they see this scan of, there's a bulging disc, right? There's something going on, right?
Very normal,
which could be mechanism of pain, but for a lot of people could not be mechanism of pain.
I was going to say, there are so many people that have a bulging disc that are either asymptomatic and they never know until they have a scan.
Exactly. So now that you magically have the scan, and I can think of so many people in my life with this right now. And the doctor, who is a general practitioner, not a specialist in movement and exercise and all these other things, rehab of this kind of thing, said, you should not do any kind of weight training for the next 6 months. And that was the diagnosis. That was what they should do. Yeah. So that, yes, they might probably feel a little better initially, right? They're not doing things that were irritating them acutely. Yeah, putting a bar on your back is probably going to feel more in that moment, a little bit more painful than not doing that. But that doesn't mean that avoiding those things for 6 months. And what's this magical number of 6 months? That's gonna heal in 6 months without a mechanism of rehab or a game plan. So it's kind of this balancing act of, there's so much around it of either the don't do the things we know you should do, or that we're seeing, or at least giving a try, because there's so many things that could, for that specific individual, it could be more. They need more tissue length. They need more range of motion. They need more mobility, or it could be they need more specific strength or stabilization or avoiding specific movements. But on the other end of it, then this person where it's just saying, the diagnosis is avoiding it and then just not taking action. That's a game plan. And that's where I get really frustrated of there should be some sort of game plan. Yes, you may need to take a step back from the intense things you're doing, but that doesn't mean, okay, now go sit on the couch. And you might have mentioned this earlier, but the data is clear that I don't even need to give the caveat. If you're extremely acute with some of those mechanism injuries we talked about, that might be a little different. But the game plan should not just be rest it, right? Unless you're extremely acute and you need a day or two to rest it. We know now that any movement, it needs to be the right movement, the right dosage, the right volume, the right mechanism, all these different metrics around it or variables around it. But the answer is not rest it, don't move, just sit at home. That's not the answer.
No, it isn't. It isn't the answer at all. And that is the thing that I think drives people to then what you said, well, what can I do? Where do I go to get the answers that I need? So I think this is a huge issue. So I think going back, maybe this is not the reason I wanted to talk about this today is not to give all the solutions for back pain. That's fucking impossible.
Yeah.
It's so individual.
It's so individual. That's exactly. It's so individual.
So that said, for anybody listening, you finding the answer to your problem on the internet is not appropriate. You're not going to find the answer there. You might get in the ballpark. You might get lucky, right? But that is not the right answer. What are the things that you should understand at a higher level to maybe start to make some different decisions about how you address the thing? Mm-hmm. So first off, I think this goes back to the word awareness. What is the problem? And so maybe we just kind of talk about things that people could relate to is where are you feeling this and when are you feeling this?
Yes.
I think that's a thing that people miss. It comes up for them in places and the check engine light comes on, but they ignore it. Or it comes on and they put their finger on, they somehow make a decision. It was this exercise that did it at this time. And that may be very right on. And that very specific exercise may be doing this very specific thing to you. But it almost always comes down to they've decided what it is and what it's not. And so we should talk about this, in terms of what are the things that kind of manifest word of people? What are some of the common things that kind of turn up for people? And then what is their mindset, or what have they decided the problem actually is, versus what it maybe really is, if that makes sense. I don't know if I'm articulating that right or not, but like, again, like, so going back to like the squats, right? Or the no exercise, and you brought up the putting the bar on your back to do squats.
Yes.
Like immediately the first thing that somebody hears when they have some type of a back issue, is don't squat anymore. Well,
Or
why?
don't deadlift.
Or don't deadlift.
Don't hinge.
They never say hinge,
Yeah.
Ryan.
Yeah,
You're giving them 2
Sorry.
points.
Yeah.
Yeah.
Don't deadlift.
Don't deadlift, right? Don't squat, right?
Yes.
It's those are the two answers. But we gotta dial this back a little bit and kind of figure out like, well, what am I actually feeling, and when is this coming up? And how could that help me understand maybe what's really going on here? Is it happening during the workout? Right? Is when you do a specific movement, it specifically hurts? What could be going on there? A lot of different things, but does it mean that the exercise is bad? Or maybe does it mean that your movement pattern is poor?
Yes.
Does it mean that you could be weak in some areas that does not allowing you to do that thing properly? It doesn't mean the exercise is doing that. Let's think about this for a second. And I get that a lot. Like people are just like, I will not pick up that kettlebell, in a Romanian deadlift because I know it's going to hurt my back. And there's literally like fear in their face, or whatever. We see those people out here all the time, like because they bent over underneath the kitchen counter and they wound up on all fours going, oh my God, I threw my back out. Right. Yeah. And this looks, whatever, like
similar,
like that movement. Yeah.
Yeah.
Yeah. You get it.
Yeah. So, I mean, man. And so I think squatting is very typical, but I think that bending over thing, the whole bending over, I'm just not going to do that movement, which, see how the next time you have to pick up a pencil, how awkward that is for you. I mean, and I see that still with the clients that have more of a history of that, of they go to pick up a weight and they try to stay as straight and upright as they can and just bend to their knees. And it's not a natural movement pattern. And really, honestly, with something like that, one, the psychology component, they're building more fear around a specific movement, but they're also honestly probably getting into a motor pattern that you could argue is worse, right? But,
you want the quickest way to a back problem? Stop bending over.
Yeah, exactly. So, and that's where I think you have to realize, all the things that you're talking about, that what is it, are you feeling that's in a very specific movement? And are you feeling that during the workout? Are you feeling it during this specific exercise? First thing I would look at, especially if it's very, very, only do that movement, you feel it, you don't do other things, or you do other movements that are even maybe similar, you don't. One, I think that's when you would look at, talking dysfunction, but maybe there's not some optimal or some, let's say, advantageous movement going on there, right? So I say people, okay, every time I deadlift, it hurts my back. And then you see their hinge pattern and they have no degree of trunk stability, control. So sometimes for that person, it's just you need to learn how to be able to brace while you're hinging, right? It can be that simple. And that's the thing that fixes their back pain. Some of them, it could be more complicated. It could be imbalances. It could be things that are causing where something is just getting overworked. So maybe if you're having more of a balanced movement, that is going to make it where that specific side is not getting overworked. So all these things is where you're taking notes, whether you're with some sort of practitioner or coach that's helping you find and sift out these things that are things that set you off or not. It's taking these notes and trying to see and picking out these variables for you as an individual.
And then it's replicating it.
Right?
Yeah, so, and that takes time.
Yes.
And it takes some patience. And it also takes some intestinal fortitude to be able to push yourself to the point of, what is the threshold here? And I may be a little uncomfortable after doing this. I need to understand that, but we need to understand it. Sometimes it means pushing into the discomfort to understand it better. But going back, like, is it happening during the workout or is it just showing up after the workout? And what is showing up? Like, is this, and maybe Cece, this is a question for you, like, is this more soft tissue or muscular? When I say soft tissue, let's be specific about it. Is this more muscular or is this more orthopedic?
Orthopedic or neurological, as far as like, is it burning? Is it tingly? Is it radiating somewhere else in your body, as far as like into your foot? Or, if you think it's radiating into your butt cheek, is it on one side or is it on both sides? Whereas muscular might be, to the touch, it might be tender to the touch, or one side might be a little bit more swollen if it's soft tissue from, the next day after doing a particular activity. Is it stiffness? When you wake up in the morning, can you bend over to put your socks or your shoes on, or put your underwear on, or can you squat down to get to the toilet? Those types of things. And if you are squatting down to get to the toilet, are you feeling it in your butt? Are you feeling it in your low back? Or is this numbness, tingling, burning?
So you just went through a lot of things there. You just covered the whole gamut, really, in a very short period of time. So the first thing you said is like, is this neurological? And I think that would be the one that I went to last. But let's handle it first, since you brought it up, and since I can very much relate to this. Like, what is happening? Like, what are you feeling and when are you feeling it? So as an example, like, I have to be careful with all the movements that I do, but with my back issues, and I'm acutely aware of what those issues are at a very deep level. Been there, done that, gone through the whole thing. That's not everybody. So I just want to acknowledge that. But what happens for me is it's not during the workout. Like, I don't have an issue during workouts. Any issues I have during the workouts are in my head, because I know what I should and shouldn't be doing. And sometimes I want to push a little harder and whatever. But where does it show up for me? It shows up for me after the workout, and it starts with numbness and tingling, which then moves into pain. And that pain, so specifically like that, it starts to radiate, or the numbness starts in the back of my leg, like at my high butt cheek, and it starts to work down, and my foot goes numb. Right? My toes go numb. My first two digits go numb. My great toe and my first two digits start to go a little bit numb. I feel that tingling, and it goes up to the back of my leg, laterally through my gastroc calf area, starts to get a little bit numb, and then in behind my knee, and I can start to feel it tingling, then up through my hamstring area, and then up into my butt. Very specifically, I know what that is.
Yeah.
That is pressure being put on the nerve plexus that runs from my spinal column down through my leg, all the way down into my foot. What is causing that?
Inflammation.
Yeah.
So that is not so something is pissed off there, right? Something is pissed off there. Now, my back is a dumpster fire. So there are a lot of things going on there. But if you are feeling those kinds of things, then what you're feeling is inflammation or pressure around the nervous system that's supposed to be talking to your foot. And
the nerve roots probably.
Sending it all the way back up. That's a thing, right? So that's one thing you might feel. And I feel that after a workout, not during.
Well, hasn't there been some instances where shoes, after wearing certain shoes for a period of time, you get that as well?
100%, right?
So it might not even be an exercise.
So I wasn't going to get to the what's causing it yet, right?
Okay, sorry.
So the other thing you mentioned would be so that's one thing. The other thing you mentioned was on the soft tissue side of things, is it tender to the touch? Like when you put a finger out, I can put fingers all the way down my butt, my back, my butt, all the way down into my foot. Nothing bothers me there.
Yeah.
I'm fine with all of that. There's no issues there. But is it tender to the touch? Is it do you have inflammation? Is there swelling that you can see visually? Is that going on? Why would that be?
As far as the swelling, if you had a muscle strain or, an acute issue. I mean, usually when you have swelling, it's not something from a chronic issue. It's usually there's been a mechanism of injury that has then elicited this inflammatory response of the soft tissue, like muscle tissue. I
don't know a lot of people that do that in the gym, right? Those types of injuries don't generally happen in the gym. It usually happens outside the gym when they're involved in some other activity. It's running, it's snowboarding, it's skiing, it's playing a sport, it's pickleball. Yeah. It's whatever the hell that they're doing outside of there. Very, very rarely does it happen in the gym. It's usually a little bit more controlled, right? Where you kind of see it. You know what to do. These are familiar movement patterns, things like that. It's usually something that happens outside.
Yeah, I was going to say, typically if something were to happen in the gym, you would feel it right away.
Yeah.
You would know it.
Yep.
Yeah. Well, and I think with something like that, even though it's a soft tissue thing, I think there's a neurological component of a lot of times that, it happens when you're unprepared for a movement. And a lot of I find a lot when people say they throw out their back, that's like a back spasm, right? That's where tissue specifically locks up. And a lot of that is your body was simply trying to protect yourself because you were in a movement that you either weren't prepared for, weren't stabilized for, or you just haven't gotten it. So, the common one is they're rotated and then they're trying to hinge and they pick something up and they're just not even thinking. Every time I talk to a client like that, they don't hurt themselves deadlifting when they're aligned, and they hurt themselves when they're just like, oh, I'm going to pick up my keys over here, and they don't even think. And so a lot of that soft tissue response can be even that neurological action of, I'm trying to protect my spine. Your brain thought something was happening, so I'm going to lock this tissue up. And that can be a lot of times assessed by replicating a very specific movement. So if it's a specific muscle, we can go through what's the action of that muscle and does that irritate it? So, okay, so if it's your QL, does it hurt when you side bend and rotate? Does it hurt any of these movements? Does that cause that same sensation? And so that's how you can kind of know from there. And that, honestly, in my opinion, is probably the best outcome, because that's probably the easiest thing to... The soft tissue thing, if something like that, where it's a spasm. That's something that you can very quickly get to calm down, very quickly get your body to trust a movement pattern again, very quickly get some blood flow. And I've had people that feel like they can't walk, and then they come into a session and it's soft tissue like that, pretty apparent, and they can leave that session almost feeling 100%, because that's an easier, there's not a bigger mechanism of injury.
Yeah,
my experience.
You mentioned the easiest thing to fix, and oftentimes what you're looking at there is, let's go back to like the orthopedic stuff. What's happening, like particularly at the back, which is what this was about, was there's too much or too little motion somewhere, or a combination of both, right? So your body's trying to pick up, say, some motion in one area of the spine because it doesn't have it somewhere else. Again, in that you're rotated, bent over, trying, going down to pick your bag or your keys up off the floor, as the example went, and it gets too much motion in an area, which then creates issues for the nervous system, right? Which then says, this isn't good, which then goes back to let's just lock it down though, and protect it, which is the quote unquote throwing your back out. You threw nothing out.
Yes.
You threw nothing out. What happened is your body is protecting you from doing something that you haven't prepared yourself for, right? Or seemingly it thinks that because you haven't practiced that movement pattern enough, and you haven't picked up that motion in the areas that you needed to pick it up in, and you didn't strengthen other areas, which is why you likely don't have that motion, right? Because you're not strong. And so your body has, again, had to overcompensate. And so this goes back to the orthopedic thing, because that's not an orthopedic issue. However, at the deep root there, it does have to do with how the skeleton and the joints are moving together. But you mentioned something about like waking up in the morning after a workout feeling stiff, right? Which is different than sore, right? Yes. Like, so when we're talking about like muscular soreness, that's that soreness of like maybe you did pull, quote unquote, pull or strain soft tissue, or you went through a really intense workout and you're feeling the DOMS, or whatever later, that delayed onset muscle soreness. But when you say stiffness, let's identify this for people so that they kind of get a better understanding of what you mean.
When I say stiffness, it's not superficial. It's more deep. It's more, how would you say, like, it feels more
restrictive. That's where I kind of
joint restrictive.
Joint restrictive, yeah.
Like everything's not moving individually, I guess, as far as like if we're talking about the spine, everything feels really locked up.
Tight.
So you can't articulate your spine vertebrae by vertebrae. It's like it's locked up. It's stiff. Yeah. It's deep feeling. Usually, like if you were to take a deep breath, you could feel it deep within like your joints. That's kind of a stiffness.
I think a common one for that is like someone SI joint, a lot of discomfort. That can be very sharp and very restrictive in movement. And it's more deep at the joint. It's acute. You can almost put your finger on it. This is where I feel stiff. This is where I feel immobility, or this is or specific movement irritates this. But it's not, I don't have range or I'm sore like you're talking about. It's like this joint feels like it's not moving or allowing me to move.
Yeah. So again, there's other things that I think that come along with that too. You mentioned like that restriction that you're feeling. Like it's just like, it just doesn't want to move. And there's not necessarily a ton of pain associated with it. It's just like, this thing, my knees just don't want to bend right now. Or my ankles and feet just don't want to work when my feet hit the floor in the morning. What is going on there? Commonly with like shoulders or hands, as we think about or talk about like joint issues, arthritis, things like that, things that could be restricting joint movement beyond the soft tissue or muscle tissue or connective tissue. And that is maybe
synovial fluid,
the
like swelling.
There you have it. That's what I was trying to get out of you.
Got it.
Was, like what's going on deep inside the joint? Like what is irritated, right? We talked about the shoulder a couple of podcasts ago. And like, if you don't have great mechanics there, let's just say they're poor and you're constantly stressing them out over time, whether that's in the gym or on the job or whatever else, ultimately that joint is likely going to become irritated in one way or another. The soft tissue around it can get irritated. The articular cartilage, the bony pieces that touch one another and that have little coatings on them or coverings on them, for lack of a better term.
Articular cartilage, yeah.
That's what I'm trying to define. Those things can get pissed off, right? And they can get irritated. Your body has fluids you mentioned the synovial fluid that it produces to keep that nice and sort of lubricated. And if that's not up to par, you're going to feel like this joint stiffness. So there's these things, these problems, as you mentioned, are multifaceted, and those are some of the ways to kind of, what am I actually feeling here? And yes, there could be some pain associated with it, but that's generally not coming from that's not necessarily coming from the joint, right? It could be coming from the tissues around the joint that are having to work hard to try to make that joint do things that it's not doing very well.
Yeah.
So those are things to understand. I think, going back to the back, right? And what you should be doing. I mean, if your body hurts going down into a bending position, the last thing you should be doing is avoiding going down into a bent over position.
Yes.
You need to be practicing that.
Yeah.
And stretching it, that could be making it worse.
Yes.
Right? So I think the next question that we should be answering here is like, what is it that makes it feel better? So you have these things we talked about, nervous tissue. We talked about soft tissue. And we've talked about the skeleton and sort of what's going on at the joint level or those articulations. What is it that makes it feel better? So what I heard this guy say is, I need to get into traction. That'll make it feel better, right? I heard this other guy say, just resting it or not doing anything, it generally feels better, right? Another guy was like, I 100% have to take anti-inflammatories. Right? That's what makes it feel better. So, and another guy was just like, I just cannot do these other things. And as long as I don't do these things, like I feel better. Those are a lot of feel betters. None of them are a solution to probably the underlying problem there. Again, this is taking away from anyone that's uber acute for whatever their reasons are. But let's go back to like the nervous system thing where this guy's feeling like his back is locked up, right? Nervous system, and also his muscular tissue. And when he gets in traction, it makes him feel better. Why is it making him feel better? Like, again, we don't know a specific problem, but what could be some of the things that are going on there?
Decompression. Are you talking about? Like, as far as, when you are applying traction, you are creating space in between the joints. So creating that space helps to alleviate the pressure. And so alleviating the pressure then makes you feel a little bit better temporarily. But unless you work on creating stability and strength so that you can release the pressure, but then stabilize in that position, you're just going to go back to having that pressure again.
I think about when we had Tony Ryan in here and we would do all these motor drills.
Love Tony.
Tony, great guy. Super, super unique in what he teaches, but amazing, especially when you implement it. But a lot of these neurological things where he even did a couple drills. We were playing with finger. He was, getting some passive traction, and then he was getting some active distraction or opening of joint spaces. And the different effect that you get when you have a passive traction, because it's still, even though, yes, you're literally pulling these joints apart. If you're hanging upside down, yes, your spine is going to get some traction, but it is still neurological. Your body is still going to go back to, as soon as you walk away, take 5 steps, it's going to recompress. It didn't learn anything. Mm-hmm. So that's where exercises that cause an active traction that all have a good effect. This is where Eldoas come in. These exercises work on creating joint space. So you're getting all those same benefits, but it's teaching your nervous system. You have to work. You have to work against gravity. You have to work in these postures.
You have to do this yourself. You have to do this yourself. The positioning.
Exactly. So that's where an exercise like that for this person who finds benefit in traction, where they create joint space, which will bring in things like synovial fluid, but also flush out waste products that need inflammatory markers, things that need to be cleared out of the area. but it also is teaching your nervous system to not be compressed. And maybe it's very specific to one side, one joint, one movement. And that's where the benefit of an exercise like an Aldoa can come into play.
Yeah, you don't need a machine for this.
No.
You don't need a chair for this. You don't need a strap to hang from your door jamb.
You have to do
for
work.
this. You have to do work. You can do this at the gym, at home, wherever for that matter, and you can do the work. So that is a really great example of like, what are we doing to continue to keep the space once we have it?
Yes.
And sometimes, again, like initially, again, if you're a little bit more acute, having that passive traction done can feel really great, and it can give you, but now what?
Yes.
Because as soon as you walk out of the chiropractor's office, get into the front seat of your car, sit back down with gravity in that hip flex, knee flex position, right? And then, or go to work and throw that plate carrier back on, or go to work and have to stand on that hard tile at the hospital and shift beds around and move people and all that stuff. You're right back to the same thing you were doing. With you haven't addressed a thing.
Yes.
You just gave yourself some temporary relief.
Well, and to build on that, this bleeds really nicely into the person who needs to foam roll their back, whether it's every night or before a workout. If that helps you be a little bit less inflamed, acute,
great.
For that immediate, 15 minutes after, that's great. But really a better way to go about that is maybe you have to do that at the beginning of your workout because you have some inflammation. You have you're very neurological at that point.
Switched on.
You switched on. But you do that, now what you should do is that opens up movement or tells your brain that you're allowed to do more movement. Now that's where you need to attack either specific exercises.
Start bending,
start moving, start stabilizing, whatever that you have found to be effective for you or that the practitioner you're working with is finding. That's where that has its place. It does if it's lets you get through the work that you need to do, but you have to do the work. You can't just do the passive thing and then hope that makes it better.
Yeah, it's a really great point. The articular cartilage stuff, like getting back down into the joints themselves and maybe having some arthritis, synovitis, where you've really irritated the joint capsule or spaces, articulations, whatever they are, is a little bit different.
Yes.
You want to go through that just in terms of things that you could do to find, or things that people may be doing that they're finding relief and thinking that that's the answer when these things come up?
I'm not really sure where you're trying to lead me. Are you talking about like massage or?
Yeah, I mean, okay. So I know people that basically have like maybe a raging case of like synovitis, and guess what they go do? They get a fucking shot. They get a cortisone shot.
Yeah.
They take a medication, right? They take This goes back to the guy with the anti-inflammatories. Like, why is it like that? Why do you feel fine on an anti-inflammatory, but when you're not on an anti-inflammatory, what is causing the inflammation and what are we doing to address it?
Well, as far as like, if you're going in and you're having a steroid injected, that's, from a chemical process. I mean, that is basically numbing your sensation of what's happening down there. So it's providing, and it's creating some anti-inflammatory effect because it's creating the anti-inflammatory effect, but it's not fixing the root cause. Yeah. It's just masking the pain. And so people think that, oh, well, I don't have any more pain, so I can go ahead and go back to whatever activity I was doing. But the pain's going to recur in another 3 months or 6 months when, that process has dissipated and you're still continuing to do the same shit that you've been doing.
Well, and so for this person who has this kind of chronic inflammation, or maybe it's acute, it's irritated by these things, that's where you need to look at other things that address your inflammatory markers, like your sleep, your nutrition, these other things. And we talked about this earlier, movement. A lot of times this drainage of waste products that we get from inflammation, a lot of that is cleared by like low impact movement, like walking. So not sitting on the couch, not laying there. That's not doing a lot to clear inflammation. So doing these other things around it, or there's exercises that are more specific to joints, like a car is a great exercise that moves a joint through its full range of motion to create and bring in and clear some of that inflammation, but then also bring back in fluid that it needs into the joints and releasing that synovial fluid into it. So I think that's some other intention around that versus just masking the inflammation, but fixing, maybe it's also fixing patterns that are causing it, right? So if you get swelling in your knees, or, we're talking about back pain, but if you get swelling in a specific joint from a movement, it could be just overworking that joint. It could be your training volume. It could be a lot of these other factors that are causing that. So if these other things allow you to fix those things, great, but you can't just do the things that just damper it down and repeat that. So
Yeah, I think a lot of people are looking again for the answer, and they're going to the internet or they're going to they're going to a physician, which is a great place to go, right? Like let's go find out what the problem is. Let's go to the experts, and we mentioned kind of the different people that you might run into. The interesting thing about that is that whoever you choose to go to, you're going to get an answer that person is almost pre-programmed or been trained to give you, right? And whatever it is. And so understand there's some level of bias that will likely come up there. Whether you go to a chiropractor, you go to a physical therapist, you go to maybe a somatic therapist of some kind, or you go to a general practitioner, you go to an orthopedic surgeon, you go to an osteopath. Like they're all going to give you maybe a similar but different answer. And that can be a real challenge for folks. And they go out there and they start to, again, do their research or fill in the blanks, quote unquote, finish the story, on what exactly it is. There are different diagnostics that you can be run through in order to ascertain like we think this is a mechanical problem and it's happening here. Could be soft tissue, maybe it's skeletal. We don't know. So we start doing things, and that typically there's an X-ray, right? And then there's an MRI if you can get to that level. And so that'll show you kind of what the body is looking like statically, right? And, to maybe make a better guess on what it is. But there's one thing, and this is interesting. We just saw our buddy Justin Brink. He's up in Idaho now. Cool. Justin. He was here in this studio where we're sitting right now. When this was strictly a treatment room, he was here with with some of his chiropractors here back in the day. I miss Justin a lot. Premier Spine and Sport, or Sport and Spine. Sorry, up in I believe they're in Boise now. They could be in Meridian. I don't know, but he put this little post out the other day. I think you actually put it up too. I think I saw it there on your feed. But basically, it was this, and that is an MRI and X-ray can't find your pain.
Yes,
can't tell you what your pain is. All it can do is provide an image that can then help somebody maybe understand a little bit more about what that pain is. So just giving imagery, right, and then deciding, oh, that's the problem. I can tell you from my personal experience, that can be a little bit of a slippery slope. And that isn't always the case. Just like I don't want a doctor that treats specifically on my lab work, I want them to be asking me other objective questions about maybe what's going on, as well as subjective things about what's going on in my life and the things that may be contributing to this on the side. Not just, well, the marker says this, you get this medication, right? Or the MRI says this, oh, we know the answer to that, right? So, and again, understanding that whoever you may be getting these answers from may be a little bit biased, and that's okay, that's fine. But having that higher level of awareness of maybe what's going on in there, can then give you some maybe more direction on where to go next, what to do, what not to do. But hopefully it breaks you out of this patterning of going, that's the problem.
Yes.
At any level, right? Oh, I see the little bulge. Oh, that's the problem. It's the bulge. No. What does that mean? And number one, how to get there.
Yeah.
Right? Like was that an acute injury? Is this cumulative? Like what's going on there? Beyond that, let's look at now how things move globally and what's happening around this thing, right? And then what am I actually feeling? When am I actually feeling it? What actually makes it feel better? And now what actually might I be trying to get it to feel better and be and work better? And along the way, take notes. Like, this didn't feel good. This felt shitty. Does that mean it's wrong? No.
Yeah.
Just means it made you feel shitty. It doesn't mean it's wrong yet. Like we don't know that yet, but stacking all these things up and also putting away this, if I do that, knowing that it could make me feel shitty, then it might take me away from doing the fucking 15-mile runs I do 4 days a week.
Yeah.
Maybe you do a little less running.
Yeah.
Right.
And again, it could be temporary.
Because
it doesn't have to be forever necessarily.
No, exactly. Because I can tell you this. If you just keep doing the traction,
it's not going to fit.
And then going out and running 15 miles 3 days a week, guess what's going to happen?
Yeah.
Not only are you going to continue to have back pain, I can almost guarantee, I'd bet my life on this. Not only are you going to continue to have back pain, you're not going to be able to run.
Yeah.
So now you're going to have both things working in your camp. That's what's ultimately going to happen. And that could be a career ender for you. That could be a life changer for you, going back to the psyche and what's going on. The next thing you know, you're in the doctor's office for pain medication. We all know what can happen there. Or worse, you get into the depression, right, which comes along with that. And we know what those medications, SSRIs are not good. They are not good, right? And not saying don't use them. I'm not saying they're bad for everybody, but as a means for pain management, That's a symptom.
Yeah.
That's a symptom of a greater problem that you weren't addressing, you were ignoring to go run and, take the temporary fix. You see where that's going.
Yeah, and I mean, I feel like that's a lot the definition of insanity for a lot of people.
Yeah, it's crazy.
Is they compete, they continually try to do these things, and then it doesn't work, but then they do it again. So I think with this, instead of being, in this vicious cycle of like, okay, it makes me feel a little bit better, and now it hurts again, now it makes me feel a little bit better. You can't be afraid to test the waters a little bit. You just said all these things you need to see. How do you respond to this? How do I respond to that? What works for you? If you're never actually testing the waters, you're not going to know that, hey, maybe for you specifically, you do need to strengthen around the tissue around it. Maybe that is going to be the big fix. But if you never try to strengthen the tissue around it, wherever you're acute, like that, you're not going to know that that's the fix for you if you're only doing the passive traction. Or on the other side, maybe you're only trying to do strengthening exercises and you are a little compressed and you need to work on some maybe more mobility at your spine or back or wherever. You will never know unless you test these waters. And so that's where with going to these different practitioners, or ideally let's say the practitioner that I would want to go to would also try these different waters with you and see if there's a good response. Giving it the old college try for each thing, but seeing like, okay, for you, as a specific individual, you are responding to this, and then now this is the direction we're going to go. It's not that this other stuff doesn't exist. It might be more beneficial for you. And so that's where you're testing, seeing working with different practitioners to see what works for you long term. But if you keep getting the same issue with no improvement and you keep not having any traction, then why are you continuing to do that exact same thing over again? Traction, if you have no actual traction.
Yeah. I mean, I think the way we started this podcast is all multifactorial. And a big takeaway for me in having this conversation is that you have to be an active participant. You can't be a passive bystander.
Love it.
For your own healthcare and well-being. So you have to be involved. And the other thing is you have to pay attention with that. And then it's patience. Nothing's going to get fixed overnight.
No.
So, it's like you said, taking inventory, taking notes, what's working, what isn't working. Can you replicate it? Just because you are replicating it doesn't necessarily mean it's a bad thing yet. It's just being aware, and being patient with the process.
And I think to note with that, you need to be an active participant. But to go back to your point earlier of looking on Instagram at fancy exercises, something that irks me to no end is when I see it's super popular to go like this one exercise, you do this one exercise and your back pain goes away. And I hate that. And people look and they see these things, and I see friends and people I know who are following this and looking at this and see this, that they can't sift through the bullshit of just thinking this one thing is going to fix it. So that's not being active, being an active participant. Being an active participant is finding guidance from someone who can actually guide you, who has experience in the industry, who has the qualifications, can actually be someone working alongside of you.
Yeah, but you also doing the work.
Yes, you have to do the work, but I think it's defining of like, where are you getting this work from?
I think that's a really good point. The mindset has to kick in too, going back being an active participant. You got to look at like, you like your routine. I get you like your routine and you don't want to leave your routine. Where's your routine gotten you? I'm not saying that was the reason for your issues, but look, where's it gotten you and how is it helping you or hurting you?
Yes.
And so you have to be able to step back and go like, I might have to do something different in order to get better for a while. And you've got to accept this.
Yeah.
Like number one, to even go down the path of now what do I need to do?
Find a new routine.
Find a new routine. Find a new route, at least a little bit different than what you're doing, because if you keep doing the same things and you keep getting the same result, going back to the definition of insanity, one thing's for sure, you're going to keep getting the same result. And it's probably going to get worse. They generally never get better. And here's the other thing that I would generally say, and almost every time when we have these issues that come up, again, setting aside some of the more acute things that may happen, most of these poor mechanical issues that create this inflammation, create these nervous system issues that lead to the bulge, the bulging discs or the herniations or the things as they accumulate over time, again, outside of maybe like this very acute injury that somebody might suffer from, is there the fixes, or you could even say some of the things that lead to the cause are rooted in very fundamental things. You just said it with regard to like looking for the fancy fix or the fancy exercise. There are none.
Yeah.
There are none. The body does some very specific things, and there's some really cool ways of applying those very specific things, but there's no magic answer for any of this. We've just tried to cover what the answers aren't, right? So I have to go in there and go, there is not a specific exercise that is going to fix your problem.
Yes.
Right? Just like it wasn't likely a specific exercise that created this problem. Is a combination of looking at this from a lot of different angles. And again, you guys just did a really good job sort of summarizing all that and articulating it. I would just encourage people to kind of take a step back, right? If they know they suffer from this stuff, or that they have there's a potential for them to have this back pain, and it leads down this slippery slope of all these other things, thinking about it long term. If I knew then what I know now, would I have done things differently? I was pretty fucking dumb then, and I'm still dumb. So maybe not. But I do know this. I would have done things slightly differently. And part of that was I would have moved more. I would have done less deadlifting, less squatting, less bench pressing, less linear, movement. I wouldn't have loaded as much because I didn't need to. It was dumb. I would have done, I would have spent more time on the jiu-jitsu mat. I would have or martial arts to stay mobile. I would have done more things. Those are things that I can say confidently. But, in terms of the exercises I picked, it doesn't fucking matter. Like, your body does some specific things. It hinges, it squats, it flexes, it extends, it rotates, right? That's it. That's all it does. Applying the exercise is an important piece of this, but don't go looking for an exercise to fix your problem, right? Or a contraption, right? Or something. Look deeper, understand the things that we've kind of covered. And it's not easy, right? This takes a lot of patience. And I would say that first. It takes a lot of patience to work through these processes. Do your best not to self-diagnose. If you don't like the diagnosis that you got from the practitioner, that's okay. That doesn't mean they're wrong. It doesn't mean you're wrong. Go get a second one. You go back to my buddy with the neck. He's going to wind up seeing 3 people in the end. And I go, dude, if you have that opportunity, go see 3 people. Yep. Go see 3 people, whatever. And it's not that he's looking for like a way out of what the problem is. They know what the problem is now. Now, what's the best way, where he is in his process, is what's the best way to go about fixing this or getting to a better result? Let's just put it that way. Like, he might not be fixable, right, in the larger sense, but there is some stuff there that he can attack. So now he's looking for like, well, what is it that I can do and I know I need to change my routine at this point because what I've been doing isn't working, right?
Yes.
So he's come to these different pieces. It's taken months. Months of being in pain, right, first, and having shit taken away, and like really going through like a lot of psychological and emotional issues, physical things too as a result, right, which trickles down into all the other aspects of his life and his job, right? And now he's through this process of, I'm feeling pain and I'm not able to work out the way I want to. So now I'm seeing a doctor, I'm getting the realities, or doctors, and I'm getting the realities of what my situation actually is, which then kind of almost starts you right back at the peak of that mountain that you have to like come back down with regard to the psychological, the emotional, the like, I got to wait more time. We have to find out the next thing to know what the next thing is going to be, and all these things. But the important part here is taking action,
yes,
and not stopping. He's still moving. He's just like, I just probably shouldn't be doing it the way I was doing it. Cool. Let's find a different way to do it. So anyway, wrapping up, guys, what do you want to say? Tell people about back pain and the to-dos and not to-dos.
I think really just reiterating what you last said, and this goes for anyone in any kind of pain, is the answer is not to throw your hands up in the air and just ignore it. That's not the answer. It never will be the answer. It's not going to just go away. And no matter where you're at, it may be a long process. It may be really frustrating, and it can be very emotionally, psychologically, mentally damaging, right? And it can be, but don't give up. There is some sort of solution to help you get to a place that is better than where you're at right now. Don't just throw your hands up.
People don't like change at the end of the day. But you're in the situation that you're in because you've probably been doing something a certain way for a period of time outside of an acute situation. So in order to make change and to feel better, you're going to have to be patient, be aware, be your own advocate, be active in your own recovery process. And then also you're going to have to change your routine.
Mm-hmm.
Yep.
Again, it's often rooted in the fundamental stuff.
Yes.
So it means go back and revisiting movement patterns, quote unquote exercises. If you don't like that word, we use it a lot because we choose exercises because that's the way to communicate the movement pattern we want people to do. But going back and revisiting some of the basics and being forced to face I'm really shitty at this.
Mm-hmm.
I'm not good at that. Or I didn't realize I'm not that great at this. And here's the things, here's a plan to make it better, right? Or at least a pathway to find out how to get better and explore things along the way. It's got flexibility in it. It's got, you're managing the reps, you're managing the sets, you're managing the volume, you're managing the intensity, and you can kind of see where you're going, and it gives you flexibility to make changes where you need to go. We got those programs.
Yeah.
I mean, they're pretty simple, and a lot of the stuff with regard to pain often is rooted in a lack of strength somewhere. Again, we talked about is it tightness or weakness?
Yeah.
Right. What precedes the other? There's a lot of things we could talk about. We do that on the show all the time, but setting yourself up for success in the long term means sometimes dialing things back a few notches. I'm not saying slow it down, that it's not intense. When I say dialing it back, just let's take out some of the complexness or the complexity of what it is that you're trying to do right now. Don't try to get it all done. Try and do a few things really well.
Mm-hmm.
And then build on that. It's like that in anything in life, whether you're trying to learn a new sport, like swim, throwing sports, right? Shooting, there's some really basic shit you got to understand before you're ever going to, do any of the sexy stuff. So check out rdfprograms.com. You'll find our strong program and our max program there, which build on one another, but they take you through a 4-month periodized program to help build some foundational fundamental movement and strength, and ultimately hypertrophy. In both of those programs, you'll put on muscle. So you change your body composition. I guarantee you'll feel better. You'll put on some muscle. You'll learn how to move better. And again, it provides flexibility to find out, what is the best thing for me given my situation. So if you've got some type of an acute thing that's going on, you can still do these programs. We can make adjustments for you. One of the cool things about being on one of the Red Dots programs is you're kind of part of our community now, whether you're sort of in club or you're doing it remotely from wherever you are. These are the strong and max programs are self-guided programs. So you are kind of doing those on your own, but you'll always have us to reach out to. We make that very apparent in all of our programs. You can reach out, you can call us, you can email us, and we can walk through how to help you the best. So again, that's rdfprograms.com. And right now, both of those programs, if you go to rdfprograms.com, are 25% off. So you just have to go to the website there, and we'll give you a code, and then you can use that code.